We're going to conclude our discussion of Chapter 2 on the counselor as a person and a professional by talking about stress in the counseling profession. So, we know that the work of helping professionals can be demanding, challenging, and emotionally taxing. And often, students in the mental health profession are not given sufficient warning about the hazards of the profession. So some of the hazards of being a helping professional are that, number one, therapists may be deeply affected by their clients' pain. We know that often people get into the helping professions because they are empaths, because they do take on other people's emotion. So logically, if you are a person who already takes over or takes on other people's emotions, and you're constantly working with clients who are going through trauma, who have deep emotional pain, you as a therapist are going to be affected by that client's pain. In addition, the commitment to self exploration that we must have as therapists can also be very difficult. So, in addition to dealing with the client's pain, you're constantly engaged in self exploration. You're highly aware of your own shortcomings, your own struggles, your own personal conflicts. And that honestly can be mentally and emotionally exhausting as well. And also, the process of working therapeutically with others can reveal or exacerbate your personal issues. So, because you're working therapeutically with others, some of the issues that your clients are experiencing will bring up your own personal issues and may also worsen those personal issues if you're not dealing with them through your own therapy or some other positive coping mechanism. So you're dealing with your client's pain, you're dealing with your own constant self-exploration, and because you're working with clients therapeutically, it's bringing up your own personal issues. So all of these are things that can cause stress in the therapist, and these are hazards of working in the helping profession. One of the major causes of stress is feeling overly responsible for your clients. So stress is defined as an event or series of events that lead to strain, which can result in physical and psychological health problems. So, as I said, one of the major reasons for stress in therapists is feeling overly responsible for your client's progress. You feel as though you are solely responsible for your client getting better, and you're not putting some of the onus on them. You're not giving them some of the responsibility for their own improvement. And in addition, the client's going to be responsible for a large portion. You may be responsible for a portion, but there might be, family members, other professionals who are involved in the client's care. But you take on all of that stress on your own, and you feel as though you're the one who's responsible for making them better. So signs that you are experiencing stress as a result of feeling overly responsible are feeling irritable, feeling emotionally exhausted, feeling isolated. We'll talk about this a little bit more in this lecture, but often therapists work alone. Therapists sometimes are seeing clients. They may also do their own administrative work, their own billing, and they're working in the office by themselves with clients coming in and out, but no other colleagues. And this really can lead to a sense of isolation in private practitioners. You don't have colleagues to discuss things with. You can't discuss your clients with other people, so you can feel very isolated. So feelings of isolation can be a sign that you're stressed, abusing drugs or alcohol, being personally less effective. So if you find yourself no longer being effective in your job, that's a clear sign that you're experiencing stress. Or compulsive work patterns. Some people, when they're stressed, they just put their head down and just push forward, and they tend to work compulsively, so they're not having to face all these other issues. So additional sources of stress experienced by counselors: getting clients treatment approved by managed care. Depending on your client's insurance plan, you may have to get things approved before you see the client. You will be responsible for billing the insurance. You may have to supply additional documentation to insurance companies. So this can be a big source of stress for therapists. Also, paperwork. You'll have to turn in paperwork to insurance companies. You'll have to do notes and maintain documentation of your work with clients. You may feel pressure to quickly alleviate a client's problem. And that pressure may come from the client themselves. It might be pressure that you put on yourself to quickly alleviate the client's problem, or it could come from their managed care or their insurance provider. So if an insurance provider only gives you 6 sessions with the client, and you know that your client cannot afford to pay out of pocket once those 6 sessions in, then you can be under a lot of pressure to alleviate the client's problem within a certain amount of time. If the mental health professional is working in schools, they have the additional stress from administration, from families, and from teachers. And often these groups have competing demands. So, if you're working in the school, especially if you're doing special education assessments, there are federal timelines. You have to have reports or assessments done within a certain amount of time. So you're going to be under stress from the administration to get those evaluations done, get those ART meetings scheduled. The families may want specific accommodations for their students. So they may be putting pressure on you. Well, this kid really needs this placement. They really need these services. And teachers may feel like you're taking children out of class too frequently. They may feel as though you are interrupting their instructional time. So these can be all sources of stress that mental health professionals in the school system experience. And finally, as a therapist, you may also deal with the stressful work environment. If you're working with others, you're going to have the same type of workplace stresses that anybody else does. So dealing with colleagues, dealing with bosses. And also, as we talked about a little bit earlier, if you're working in a private practice environment where you're working by yourself, that also can be a stressful work environment because it could be only you doing everything, seeing the client, scheduling the appointments, doing the billing, and you can be working alone and have no one to socialize with between clients, no outlet. So that can also be a stressful working environment. When you are under chronic stress, it can lead to empathy fatigue. Empathy fatigue occurs when the practitioner loses themselves in the problems of the client. So you get so involved and so wrapped up in your client's problem that you are consumed by that problem. You take on that problem as your own. So the way to combat that is empathy balance. You want to be able to enter the client's world without getting fully lost in that world. And this is one of the great balancing acts of being a mental health professional. How can you be and feel for your and be present and available to your clients while also being separate and keeping something back and not allowing yourself to be consumed and take on all their problems as your own? And I find that to be one of the more challenging elements. Now, if you don't attend to your empathy fatigue, you can find yourself experiencing compassion fatigue. So this is vicarious traumatization or secondary trauma, where you've gotten so involved in taking on your clients' problems to such an extent that now you are traumatized. You have been traumatized by being exposed to their trauma. And you may find yourself experiencing things like anger, anxiety, sleep disturbances, and feelings of powerlessness, because now you are reacting as a trauma victim. You can also experience burnout, and this is a state of physical, intellectual, and spiritual depletion that's characterized by feelings of helplessness and hopelessness. So you're not only feeling powerless, as though you can't change the situation, you're feeling like you have no ability to influence the situation, and the situation will never change. It's hopeless. Things will always be just as they are. And so if these things are not attended to, and if you're not able to develop positive coping mechanisms for all of these stresses, then you may move into the area of impairment. So impairment refers to chronic illness or severe psychological depletion that prevents a professional from being able to deliver services effectively. So now you are so impacted that you can no longer be an effective clinician. Your stress has gotten to such a level that is now negatively impacting your ability to work with clients. So one of the remedies for the stress that helpers deal with is self-care. And I feel like the term self-care gets thrown around a lot, but it's really important to those of us who are professional helpers of others. And in fact, self-care is a basic tenet of ethical practice. Because we are the tools through which we help change our clients, it's important that we take care of ourselves. So, self care refers to engaging in positive life experiences that lead to zest, peace, excitement, and happiness. And so, I really like this definition because often people think that self care is just pampering yourself. Oh, it's taking a hot bath or going for a walk or getting your nails done, which it can be all of those things. But really, self care is meant to promote zest, peace, excitement, and happiness. So often activities that we don't necessarily think of as self-care activities really are because they lead to those characteristics in our own life, to peace, to happiness. So in addition to engaging in self-care, it's also important to engage in self-compassion, which is developing attitudes of caring, being non-judgmental, being accepting, and being kind to ourselves. And I find, especially among grad students who all tend to be high achievers and very driven, there can be a lot of self judgment and a lot of being hard on yourself. And a lot of times, students will feel as though they have to be hard on themselves. They have to push themselves to get their best performance. But that is not what the research tells us. The research tells us that people who are more self compassionate lead healthier, more productive lives than those who are self critical. So, not only do you need to involve yourself in self care, taking care of yourself physically, emotionally, psychologically, spiritually, you also need to be compassionate towards yourself. Try to be as non judgmental with yourself as you are with your clients. Now, that doesn't mean ignoring your shortcomings or denying your shortcomings. It means that you deal with yourself in a kind, compassionate way with the understanding that dealing with yourself in that way will help you make better decisions. It will help you be more productive. It will help you make the changes that you need. That being hard on yourself and being critical towards yourself is not the best way to make the changes that are necessary. So I encourage you now to take the time to look at the self-care inventory that is posted in the course content section of Blackboard. So I want you to fill that out and make note of the areas of self-care that you're doing well in and the areas of self-care that you need more work in, that you need to improve upon. And when you identify those areas that you need to improve upon, think about what steps can you take to make sure that you improve your self-care in those areas.